Senior Connections, a show about senior issues and events. A guide to active, independent living. With your hosts, Margie Toms and Janet Halliday.
Good afternoon, and welcome to Senior Connections. I'm Margie Wimberly Toms.
And I'm Janet Halliday. Today we are going to talk about the elephant in the room. We are going to be talking about urinary incontinence, especially for women. I guess only in this conversation it is going to be for women. And our guest today is Dr. Pizzella. And Dr. Pizzella, I'm going to just let you tell the audience about your training before we get into the details of urogynecology.
Sure. I practice urogynecology. It's a subspecialty of obstetrics and gynecology. So you have further training in gynecologic and urologic procedures that deal with women, incontinence, pelvic organ prolapse, and other bladder or voiding dysfunctions.
Interesting. So how long have you been in that subspecialty, doctor?
About 12 years now. Yes,
we're going to card her and see.
It's something that the need was out there, right?
Yes.
So you're one of the ones that have filled that need. Is that correct?
Yes, with the aging population and the baby boomers getting older, and all these women that are living longer and more active, they're finding out that they can have something done for any of their problems that they've had that is hindering them from doing their regular activities, or even more activity like exercise and dancing and some of the things that some of our seniors do on a regular basis.
Tell us, how common is urinary incontinence in women?
About 1 in 4 women postmenopausally will experience some form of urinary incontinence, which is the involuntary loss of urine.
Right. Do you think having babies had an effect on that, as opposed to women who've never been pregnant?
Unfortunately, yes. You can blame your children. This is something that stems from having children, the delivery process, and then stretching out the pelvic floor muscles and then the connective tissue that are on either side of our pelvic organs. So definitely that sort of sets the stage on how many deliveries you have and how big the babies were. And then of course, during the course of life, depending on their occupation or what they're doing, a lot of heavy lifting. And then certainly if you had a hysterectomy or any other pelvic surgeries, that can also cause some relaxation of the pelvic floor. And then of course aging and postmenopausally, where our hormones are declining, there's definitely then more of an acceleration of the process.
Right. Back in the day, being an RN, as I said before, they used to use pessaries. Do they use them anymore?
Yeah, we still use pessaries, yep.
Oh, okay.
There are some women who may not be able to have surgery for whatever reason because of a medical issue, or they're taking care of a sick one at home, their mother or their husband. So they choose to wear a pessary, which is a conservative management for really prolapse, not so much for urinary incontinence, but we do see women who will wear those, and we see them regularly in our practice.
That must be right up there with chiropodist. She's teaching me all kinds of language I didn't know. Explain the different types of urinary incontinence and some of the symptoms that someone would be experiencing.
Sure, and that's definitely important. A patient may have urinary incontinence where they leak if they cough, laugh, sneeze, jump, exercise. That's called stress urinary incontinence. Not because you're stressed, it's because there's an involuntary loss of urine due to some exertion, something that's increasing the intra-abdominal pressure and exceeds the bladder pressure. So there's a defect, there's weakening. Then there's urge incontinence. Urge incontinence is the involuntary loss of urine when you have a sudden urge to go to the bathroom. So there's a functional problem, meaning the bladder sort of has a mind of its own. The bladder's function is not working correctly, and the signals are not proper.
And we're going to take our first break, but remember to check out our website at seniorconnectionssc.com and those events, health fairs, and our sponsors, and we'll be right back after these words from those important people.
Hi, I'm Henry Winkler, and I'm here to tell homeowners that are 62 and older about a great way to live a better retirement. It's called a reverse mortgage.
A reverse mortgage can give you tax-free cash, no monthly mortgage payments, and you still own your home.
Call Larry Reed now, your local expert, to find out if you qualify.
Ask for your free reverse mortgage guide and DVD. And when you call now, you'll also get this lighted magnifier absolutely free.
I live alone and rarely have visitors. So when I slipped and fell in the kitchen last month and couldn't get to a phone, I knew I was in trouble.
Help!
I could barely move.
Help!
I tried calling for help, but no one could hear me. As I lay there, I couldn't help but think of my kids and grandkids having to go on without me. I was terrified. It took 8 hours for my neighbor to find me. It could have been the end of me. That's when I knew I needed Life Alert. With just one press of this button, I'm connected to the Life Alert Center, where I can get the help I need, even when I cannot reach a phone. With Life Alert, I'm never alone.
We save a life from a catastrophe every 11 minutes. For a free Life Alert brochure, call 800-485-5621. That's 800-485-5621. Call 800-485-5621 today.
Don't compromise, mobilize with All Medical.
Enhance your mobility and independence with a van from All Medical. Choose from a Dodge Caravan or a Honda Odyssey and customize it for your needs. Whether you're slightly ambulatory or in a wheelchair, you'll enjoy knowing you can get around town whenever you want. You depend on All Medical to provide services and products to fit your lifestyle. Now call on All Medical to take you that extra mile.
Don't compromise, mobilize with All Medical.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support.
At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just her son and you to be just her daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
Are you or someone you love having difficulty getting into the tub for a bath or unable to stand in the shower? Call Comar Products today for help with safe, comfortable, independent bathing solutions. We specialize in products like walk-in tubs and roll-in showers. Our walk-in tubs feature hydrotherapy technology, so your bath is always warm and may even increase blood flow circulation and reduce swelling. Call Comar today to schedule your showroom appointment or visit us at 1759 Airport Boulevard in Casey.
Welcome back to Senior Connections. We are talking with Dr. Pizzella, and she's telling a lot of our viewers as well as us, she's bringing us up to date on some of the, as she calls it, urogynecological diseases, right?
Yes.
Why don't you continue in telling us about the types of incontinence?
Sure. As we mentioned, incontinence is there's different types. There's urinary incontinence with laugh, cough, sneeze, exercise. We call that stress urinary incontinence. That's due to a weakness at the bladder neck. So any increase in intra-abdominal pressure, which exceeds the bladder pressure due to a weakness at that bladder neck, will cause a woman to leak. Then you have urge incontinence, where you have a sense of urgency. You feel like you have to go and you got to go, and you'll have an involuntary loss of urine before it's socially acceptable to go to the bathroom. That's where the bladder has a mind of its own and there's some functional problems. So there's the signals that the bladder receives from our nerve pathways that's disrupted.
Okay, and then there's the mixed incontinence.
Sure.
How does that work?
Exactly the way it sounds. A mixed incontinence is a combination of both.
That sounds very confusing since it's the signals. Now, stress incontinence is the most common.
Actually, in our younger age group population, stress incontinence is the more common. As women approach the 50s and 60s, urge incontinence is predominantly increased.
urge.
Okay.
Interesting.
Oh, and I think you might have said something though about that, about lifting and things, but what are the causes of the stress incontinence?
Sure. So we talked about childbearing, just carrying a pregnancy, and then the delivery. The delivery, you're stretching out the pelvic floor muscles. That's the basis of our pelvic organs, and that's the scaffolding of which our pelvic organs are supported. As soon as the pelvic floor muscles are stretched or torn, then you are going to be at risk for some form of weakening of the tissues and incontinence.
So what are some of the treatments for that specific problem?
Well, you can treat very conservatively, like Margie mentioned, a pessary, although it's not the best solution. Pelvic floor muscle exercises. I'm sure your obstetrician at some point told you about Kegel exercises.
Yes.
Kegel exercises are exercising those pelvic floor muscles that were weakened during childbearing. Then avoidance of behaviors that you could possibly cause, like exertional things, lifting, bending, straining. So if the patient's constipated, we'll get them on a stool softener and make sure that their bowels are normal so they're not chronically straining. But the most definitive, if you go to the other side of the spectrum, the most definitive treatment is a surgical procedure. It's minimally invasive now. Before you had to go into the hospital and stay overnight, 6-7 days. Now we can do an outpatient surgical sling, which involves one incision, and you place a sling or hammock underneath the bladder neck. So you're supporting the tissues that have been weakened.
Now, I was going to say, you hear the lawyers on the television. You know, if you've used this sling, how safe are they?
They're very safe in the right hands. It is not necessarily the sling, it's the way that the sling is placed. So it's the technique of which the surgery is done. So there was a lot of controversy about who was placing the slings and how they were being placed. And if it was placed in the proper planes and the correct tissues, in the proper patients, the patients who are specifically candidates for the sling, then you should have very little risks without any complications.
So say that you've had a sling and you're having problems. Do you address those types of issues?
Absolutely. So if a patient has already had a sling, and that's oftentimes a patient will come to me after they've had a sling and they still have a variety of different maybe voiding problems, then we can actually see them and sort out what's going on. And they may have a recurrence of their original problem, or they may have a different type of problem where they may not be emptying their bladder completely, or they may be having some urgency or getting up at night and things of that nature.
I see. Okay, and we're going to take our second break for today. And if you have any questions about Dr. Pizzella or find out more information about her services at Southern Urogynecology, go to our website at seniorconnectionssc.com. And we'll be back on urinary stress incontinence.
Woodash is having a mattress sale. Why pay thousands of dollars for a Visco memory foam mattress when you can get a complete two-piece queen set at Woodash for $3.99? This quality mattress layered with Visco memory foam features a cool, comfortable quilted top for a comfortable, cool sleep every night. Highly resilient, highly durable, and best of all, at a discount price starting at just $3.99 for the two-piece queen set. For the lowest discount prices featuring Visco memory foam mattresses starting at $3.99, shop Woodash today. Woodash, located in the heart of the Vista, 919 Gervais.
I live alone, so when I slipped and fell in the kitchen last month and couldn't get to a phone, that's when I knew I needed Life Alert. With just one press of this button, I'm connected to the Life Alert Center, where I can get the help I need, even when I cannot reach a phone. With Life Alert, I'm never alone.
For a free Life Alert brochure, call 800-485-5621. That's 800-485-5621. Call 800-485-5621 today.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support.
At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just her son and you to be just her daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
As large corporations continue to take over local businesses, Carnegie and Mosley Funeral Home is still family-owned and independent. They believe that bigger doesn't mean better, and people always come before profits. That trust is earned, not bought. The Carnegie and Mosley family has been serving families since 1884. Carnegie and Mosley Funeral Home, they are your neighbors, and you'll appreciate the difference.
Welcome back to Senior Connections. We are talking to Dr. Pizzella, and she's giving us a lot of good information on some of the diseases that she treats. Now, can you tell us something about, are you the only specialist, subspecialist in your area, in your field?
Right now in the Columbia area, I'm
yes.
the only female urogynecologist. So yes, so as far as a subspecialty, I am the only urogynecologist full-time that's servicing this area. There's a few other physicians in the local area. There's a part-time urogynecologist that comes out from Greenville, and there's also some gynecologists that will subspecialize, or they have their niche in gynecologic procedures for prolapse and incontinence.
I see, sure. But as it
but
remains, you're number one.
Exclusively, I have my own center, and the center exclusively for women with these issues.
And where are you located, Doctor?
I'm located right off of 378, about a mile away from Lexington Medical Center in West Columbia.
Yes, all right.
She's always in a big hurry to take, where are you located? I want to go back to some of the surgical procedures.
Oh, okay, go ahead.
Sure.
No. We had covered the sling a little bit and talked about, but I was reading, you gave me so much material to read. I wasn't familiar with these bulking agents. Can you explain that procedure?
Sure. There are so many variety, and I was trying to explain sort of there's such a spectrum now. We have so many innovative, minimally invasive procedures. Urethral bulking is actually a procedure kind of in between. It's something that we can do in office, where we actually place almost like the bulking agents that we use, a collagen, women who want to bulk their lips. It's a very similar product, and we actually go inside the lumen or the inside of the bladder neck, and inside we inject this agent, and it actually makes the lumen smaller. So you're going from a larger, maybe weakened lumen where the muscle around the lumen of the bladder neck is not strong enough to actually thickening the lumen, so you're actually increasing the resistance, so it's harder for the urine to flow out. We call it lead pipe phenomenon. So that's sort of a lead pipe. There's it's sort of stagnant. There's no support, and there's no contraction of the muscle that's around the bladder lumen.
Now, and I assume that all these procedures are covered by insurance.
Yes, most of the, especially our Medicare insurance, most of these are covered. You may have to pay a copay, or depending on what their deductible is in their plan, but it is a covered expense.
Now, most of the procedures are on an outpatient basis? Or?
Most of the procedures that we have available for urinary incontinence are outpatient.
Well, and how can somebody make an appointment, and what should they expect from the first appointment?
Well, the beauty of my specialty is, since I'm still in that obstetrics and gynecology category, you do not need a referral from your primary care provider. The patient can call up on their own, or if they prefer, their primary care provider can refer them. They call the office, and we give them either go to our website, or we give them paperwork that we can mail to them to fill out. So it's a patient questionnaire and some information that's geared towards their disease process.
Okay, so what would they need to bring with them? Any kind of their...
So the usual doctor's appointment, their license, their insurance card, I always recommend to bring a list of medications, if not their bag of medications, so that we have all their medications with them, so we can review and go over everything that they're taking currently. And then, of course, sometimes a family member, which is nice because then we have an opportunity to speak to the patient and the family member so that you can get two sets of ears so you can hear what I'm saying. So, because it is a lot to digest in the first appointment.
And briefly, tell us what a urodynamic test is.
So after your initial evaluation, the patient comes in, we'll set them up for a test sometimes if they have that mixed incontinence, the in between the stress incontinence and urge, and they may not be emptying their bladder completely. So the urodynamic test is a way for us to evaluate bladder function. We get a bird's eye view of how the bladder fills and empties, and it demonstrates if there's any problems with that process of filling and emptying.
All right. And we're going to take our next breaks, and be sure and go to seniorconnectionssd.com and check out the local events and health fair on our website, and we'll be right back after these words from our sponsor.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Woodash is having a mattress sale. Why pay thousands of dollars for a Visco memory foam mattress when you can get a complete two-piece queen set at Woodash for $3.99? This quality mattress layered with Visco memory foam features a cool, comfortable quilted top for a comfortable, cool sleep every night. Highly resilient, highly durable, and best of all, at a discount price starting at just $3.99 for the two-piece queen set. For the lowest discount prices featuring Visco memory foam mattresses starting at $3.99, shop Woodash today. Woodash, located in the heart of the Vista, 919 Gervais.
Attention, catheter patients on Medicare.
I use catheters, and if you do too, please listen carefully. There is a new catheter that hurts less, and you can get a free sample by calling this number now.
Pain and urinary tract infections have been avoided by many of my patients. These new disposable catheters hurt less. It's an incredible new design that reduces pain. The eyelets are polished, so they glide smoothly and effortlessly across your sensitive skin. Call now and get a free sample. Medicare and your insurance will pay for up to 200 of these catheters per month, all at little or no cost to you.
Call now for your free sample. It will arrive with a complete 90-day order, and if it doesn't reduce your pain, we'll pick them up for free.
Please call 1-800-394-8763. That's 1-800-394-8763. 1-800-394-8763.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Welcome back to Senior Connections. We are talking to Dr. Pizzella. And Dr. Pizzella, is there anything that we have not covered in terms of the questions we've asked you that you want to let our viewers know and let us know?
Sure. Well, the nice thing is there's so many new things that we can do now for women, especially in their elderly patients, that they were once told that there was nothing to do. So I really feel that a patient has the right to come in and at least get some information and some education. Because there's a lot of things that just even lifestyle modifications that can be done, what we drink, how much we drink, the things that we can manage ourselves that can help with some of these incontinent issues with women. Also, too, just some really easy things that we can actually offer in the office without being invasive.
So, I mean, how old can somebody be that can benefit from some of these procedures?
We see women of all ages. I take care, there's no age limitation, depending on what their quality of life is. I mean, this is a quality of life issue, and you want to be able to give them the opportunity to give them some options. Now, there are some limitations, of course, depending on where if they're in a nursing home, their mental status, any kind of dementia, but there is no age limit.
Okay.
Well, that's good to know.
Now, we had obviously talked about the bulking and the sling, and what are some of the other procedures that can be done to address the
Well, we talked about the functional problem, and I tell a patient, you know, there's not one quick, easy fix. There's not a sling or a tack or anything that we can simply put in to make this perfect. But there are some modalities that we can use, especially since this is functional, and we rely on our nervous system to control most of our organs. So we can actually do what's called neuromodulation. And it is a way for us to actually set or reset the signals that are going through the bladder. And it's a small TENS unit that is actually temporarily placed, and if it works, then the patient is actually a candidate for a small pacemaker of the bladder.
Is that right?
It's called InterStim.
How long does it typically take to have that installed and see results?
Well, you can actually see the results immediately because it immediately works on the nerve endings because it's low voltage electrical stimulation that's sent to the nervous pathways that control the bladder. So they can actually have an outpatient procedure done within 30 minutes. And it'll be turned on, and then they'll get started with their treatment.
Sure. So if a patient is not sure what's going on, they can come in for an evaluation and talk to you and let you know what their symptoms are, and then you take it from there.
Depending on what their symptoms are, and if we have to do any further evaluation, then we can get a management plan. Because every patient, and I tell my patients all the time, you may not have what Mrs. Jones had that Mrs. Smith had. Everybody's very individualized, so everybody has an individualized plan. And we set them up with different programs, and we set them up with different medications, or we set them up with different treatment options depending on what type of incontinence they have.
And the medications for urinary incontinence, I mean, how safe are they to take? I know they have a lot of seemingly side effects.
You want to make sure your benefits outweigh your risks. And the side effects are there. There are some side effects like dry mouth or constipation. Some that can be modifiable. I often tell my patients to get lemon drops to help salivation, and also some biotin gum or mouthwash to help them with their dry mouth. But overall, the side effects are about 10%. So we get about a 90% chance of not having the side effects.
Okay. Well, thank you so much for being with us today.
Thank you.
I certainly hope that you all have enjoyed the show today. And if you go to our website at seniorconnectionssc.com, you will find a link from Southern Urogynecology, and you can go to Dr. Pizzella's website, and it has a ton of information, and you can learn all about what procedures are available for you. Please pick up your copy of Senior Living Guide, and thank you so much for being with us today.
Yes, and we'll see you next week, and please be blessed.